Well, Chinese vaccine makers and biotech stocks fell across the board Monday after Premier Li Keqiang's remarks. For more on vaccine and drug regulation in China, we're joined now by Dr. Chen Xi, who's assistant professor of public health at the Yale School of Public Health. Welcome to the broadcast.
Thanks for having me.
Explain to us how this actually happened.
There was some uncertain incidents happens that showing that there's counterfeit vaccines distributed throughout the market. And this is a single incident, but there's systematic issues with the system we need to address.
Will this set China back in becoming a leader in biotech?
This is a long way to go, as we know that the system really need transparency because health is a basic human rights instead of privilege. So in order to be a leader in the biotechnology, we first need to make the system transparent to all parties in the system, no matter whether it's to the patients, the customers, or to the providers, such as the hospitals, clinics, and also the pharmaceutical companies. And currently, we need to build such system in order to be the leader for that. For example, all parties should be informed about the production, distribution, storage of the products. And also, there's something may happen potentially or suspectedly to be a case of abnormal pattern. If that happens, we need a network to report that to the system in order to attract the attention from the regulator and also the pharmaceutical companies. And also, we need some law enforcement and lawmaking in order to make sure that the financial relations between various parties, for example, in this case, there's some potential bribery between the pharmaceutical companies and the provider, which is the hospitals, clinics. So we need to make that transparent. So if there's something happen between the financial transfers, bribe, between the two parties, there will be should be an open reporting system. This is what has been built, for example, in United States. There's a reporting system to do that. And if there's really something happens that could happen for some drugs, vaccines, then we need a compensation system. Yes. For example, in the US, there is a Vaccine Injury Act to make sure people can be compensated yes. for the loss, especially for the mandated
Let me just
jump
in here. I want to ask you, can China afford this? I mean, if you halt production of vaccine until they figure out exactly what happened, what kind of health risks are there?
If this is, for this case, vaccine case, the vaccine become invalid. But unlike something else invalid, for example, food, a scandal, this can be non-poisonous. But for vaccine, invalid vaccine is a type of poisonous because people who take this vaccine, they believe this is valid, but eventually they are not protected.
I see, I see. What other options will the people of China have during this interim time?
I think this is, we need to do two things at least. One is the hefty fine system to punish something really bad happens. But this is not enough. We need to also to make sure things operate well before bad things happen. So we need we call the ex-ante measures. For example, we need a transparent system, and we also need binding law enforcement to make sure various parties are doing their job.
Do you feel like, Dr. Xi, that people will turn to more global brands of vaccinations?
Yeah, I think some richer people, residents, may tend to globally, but this is a huge economic loss for the country because we cannot rely on the foreign markets to produce the vaccine for all the 1.4 billion Chinese people. And also there's the national security, because vaccine is not the same as regular food. So we need to have our own system to produce, to manufacture this. So this is a huge cost. And also when people turning down the mandate vaccine, the free vaccine offered by the government, and the vaccination rate will reduce. And as far as we know from the U.S. experience, when vaccination rate is reducing, it's really hard to get back because it really takes a lot of time to build the trust. And I think the huge economic cost and the social cost for this incident is that it's hard to rebuild the social trust system. It takes a lot of time, and this is a bottom-up system. And the government has taken several measures,
yes.
But we need also to promote the trust within the individuals and across individuals in the Chinese public.
Dr. Chen Xi, thank you so much on this very important topic, joining us from Boston.